The CDC says 2 out of 3 drug overdose deaths involve opioids, and thousands die each year due to opioid-related abuse.
In part 1 of my special report, Life After Addiction, I'll introduce you to a woman who came close to dying and what caused her to have a wake-up call to get the help she needed.
I started using heroin when I was 21.
Krista Turner's struggle with drug addiction lasted about 10 years.
You get hooked on that first high, so that's what you're always chasing, and you never get that again.
Turner says she and her ex-boyfriend committed all sorts of crimes to pay for their next fix.
We would break into people's house or their sheds and steal their tools and pawn those. Pretty much steal anything that wasn't nailed down.
A lifestyle that eventually sent her to prison. When she got out, her addictive behaviors resurfaced, this time experimenting with opioids.
I had to figure out a way to make money on my own, and I resorted to prostitution. You're already numb because of the drugs, so the need and the want for those drugs, it trumps everything.
The Centers for Disease Control and Prevention reports that in 2017, more than 47,000 people died from overdoses involving opioids. That same year, the North Carolina Department of Health and Human Services reports there were nearly 1,900 opioid-related deaths statewide. Turner developed a condition called bacterial endocarditis, directly related to sharing dirty needles to inject drugs. During her 4th trip to the hospital, a test showed she was 14 weeks pregnant.
So I had used that entire time. Truthfully, if I was still on drugs, then she wouldn't be here, because my first thought when I found out I was pregnant was to get an abortion.
But she didn't.
I knew that my life was in the balance, and so was this child that I was carrying, so I made the choice to ask for help.
As of June 2018, 14% of pregnant women seeking services at New-Hanover Regional Medical Center related to pregnancy, whether it be in the prenatal clinic or labor and delivery, admitted to a history of illicit drug use or recent use of illicit drugs. An obstetrics and gynecology physician at New-Hanover Regional Medical Center, Dr. William Johnstone says statistics like this are extremely troubling.
I noticed that the plan of care that we used to treat these patients was haphazard because we're not trained addictionologists. We're surgeons and deliverers of babies and provide gynecological care and obstetrical care for women, but we're not trained in addiction.
The death of one of his patients 2 years ago set him on a mission.
I admitted on Christmas Day a patient to New Hanover with complications associated with pregnancy that we later discovered was related to her heroin use, and she passed away a few weeks later, and it really affected me and my psyche.
Johnstone said he had to do something.
We're losing a generation. New-Hanover County lost 165 of its citizens last year to overdoses. When that generation is being decimated and destroyed by addiction, their offspring are the next generation of folks that get involved with illicit substances and become addicts themselves.
When a pregnant woman dies, Johnstone says it causes a ripple effect.
A child being raised without a mother, a motherless child, is heart-wrenching because you want to put that child on a glide path to success, and lots of times in those situations it just continues the cycle.
As for Turner, she's grateful she was able to make some changes before it was too late.
For somebody to be so passionate about wanting to help addicts, I feel completely grateful to him because he did save my life.
Not only saving her life, but her baby too.
It's surreal and it's overwhelming, and a lot of the time I catch myself just staring at her while she's sleeping or just playing, you know, and I'm just so grateful to be here today and to be able to give her the best life that I possibly can.
Be sure to tune in next Tuesday morning at 6:30 to see part 2 of Life After Addiction. We'll tell you about a nonprofit Dr. Johnstone created called Tides, which specifically helps pregnant women like Turner who are trying to overcome their addiction to opioids.
Wow. First, very nice job, Jeff. But also, I think it really puts things in perspective because, we've been talking about the opioid crisis for such a long time, but you don't think about the pregnant women and the other side of this.
It's really good to have a face. And as you know, with all the stories we tell every day, we need to have a good character, someone who can share their story. And I applaud Krista for being transparent and sharing about her journey. And we wish her the very best.